to the American Amnion Association Podcast, a show dedicated to exploring the groundbreaking advancement in birth tissue-derived medical technologies, the power of collaboration, and the future of regenerative healthcare. Each episode, we bring you thought leaders, industry pioneers, and medical experts who are shaping the next frontier of healing and patient care. I'm your host, Theresa Hong, and I'm thrilled to welcome Dr. Dana Ellis. Dr. Ellis is a board-certified dermatologist and accomplished medical leader with a robust background in both clinical practice and academic dermatology. She also serves as the American Amnion Association's Dermatology Medical Director, bringing a wealth of expertise in regenerative medicine, skin health, and advanced dermatologic procedures. Dr. Ellis earned her medical degree with honors from Tulane University School of Medicine, where she was inducted into the Alpha Omega Alpha Medical Honor Society and received multiple academic commendations. She completed her dermatology residency at Tulane Medical Center, where she served as chief resident and gained recognition for both her clinical acumen and research contributions. With a career spanning prestigious practices across the country, Dr. Ellis has cultivated a strong interest in medical innovation, cosmeceuticals, and patient-centered skincare. Her published research includes peer-reviewed articles on dermatologic oncology, cutaneous infections, and cosmetic dermatology, and she has contributed chapters to major dermatological textbooks, including Fitzpatrick's Dermatology. A former Olympic athlete, Dr. Ellis also brings the discipline, performance focus, and resilience of elite sport to her medical leadership. She has served as a clinical instructor at Yale, a speaker for global skincare brands, and an advocate for community health throughout her regular volunteer initiatives. But what truly sets Dr. Ellis apart is her passion for the potential of amniotic tissue in dermatology. She's not just applying these therapies, she's helping lead the movement to validate and expand their use in both medical and cosmetic dermatology, making her a visionary and leader in the advancement of amniotic tissue therapies for skincare and rejuvenation. Dr. Ellis, welcome to the show. I'm so happy you're here.
Oh, thanks, Theresa. Thank you for having me.
Yes, absolutely, man. Yeah. I think a lot of our viewers are going to recognize you because you're all over the place. Yeah.
Well, for better or for worse, that might be true. I always say, if somebody tells me they see me or I pop up on their phone, that they're never going to get rid of me. I'm just going to keep popping up. Whether that's good or bad, I don't know.
No, I love it. I love it. You've just been you've done so much, in dermatology and also, on the med spa side too, that it's always really, it's cool, kind of scrolling through and going, oh, it's Dr. Ellis. Dr. Ellis. It's really cool. Yeah. So, but welcome. I'm so happy that you're here. And and just really kind of wanted to, dig in as far as your background. I mean, obviously, dermatologist, very, very highly respected. I want to know, how did you kind of get into this whole, idea of just using regenerative medicine for, both, dermatology, MD side of things, and also just on the med spa? Yeah, how were you introduced, and why did you decide, oh, this sounds like a good idea?
Well, I think cosmeceuticals and the beauty scene right now is very popular. It's huge in in medical practice, in cosmetic practice. I mean, it's gained so much popularity over the past few years, even since I'd been out of residency. And so I was, I guess, looking for a way to be able to incorporate regenerative medicine into both the medical side of things and the cosmetic side of things as well, the med spa side of things. And I think because I and my practice do a little bit of both, I primarily, I'm seeing on a day-to-day basis my medical dermatology patients who almost always now, because this field is so popular, have questions about the cosmetic side of things and regenerative medicine side of things, anti-aging and whatnot. I like to be able to kind of explain things from both sides and to be able to use it on both sides as well. And I think now, more than ever, I think we went through a phase at one point with cosmetics where it was like bigger is better, and the unnatural was maybe a little bit more accepted. Now we've kind of gone back to um, you know, natural beauty, using things that are maybe more human derived, more natural in origin. I think that's very popular and for good reason right now. So my interest is huge in that.
Yeah, that's cool. And what have you found as far as, using just the different regenerative, I mean, we can talk about, excuse me, the exosomes, you can talk about just any type of birth tissue derived, kind of products. I know exosomes is not, I mean, it comes from fluid, but you know what I mean.
Yeah.
And just kind of, what are you using it for, and what are the results that you and your patients are experiencing?
So we know that amniotic fluid uh, has been used, or amnion has been used for years in the wound care world. And it's amazing as far as wound care goes. So, why wouldn't we use that to our advantage when it comes to regenerative medicine and in cosmetics? There's a lot of procedures that we do in the cosmetic world and regenerative medicine world where we're purposely injuring the tissue to get results. So things like microneedling, the resurfacing lasers, purposely we're using, by different means, either physical, laser, lights, that sort of thing. Even radio frequency devices will injure the collagen in the tissue. And then it has, it's being forced to kind of remodel itself. So where, amnion comes in, or exosomes in general now, is, for sort of this regeneration of skin tissue, and provides, better communication between cells. Wound healing stimulates fibroblasts, which are important in wound healing because they stimulate both type 1 and type 3 collagen. So I just feel like it's a nice complement to the regenerative procedures that we're already doing in our day-to-day practice.
Yeah, that's super, super interesting. And you were saying something when we were talking kind of offline a couple of weeks ago. You were saying that some individuals are really sensitive to like retinol, like retin-A, things of that nature, and that what you're finding is using kind of amnion-based products, that's kind of, is that given the like the is it a good alternative, basically, is what I'm asking.
No, absolutely. That, I think almost any dermatologist on the planet would say, if they could pick, and this was maybe before things like amnion came on the scene or became more popular, if they could pick one thing that a patient should use maybe on a nightly basis to, stimulate collagen, to reduce brown spots, for just anti-aging purposes, reducing, previous sun damage, retinols would be it. Like retin-A is it. But the problem is, and it does, it works wonderful, and I love it. But the problem is a lot of patients can't tolerate it because of its irritation and drying effects on the skin. And like a good proportion of people can't tolerate it. So the fact that we have, amnion as an alternative, which does just as good a job as, if not better, at promoting your body's own collagen production, similar to retinoid, but without the irritation. And actually, or dryness for that matter. And actually, as much as it could be an alternative for those that really can't tolerate retinoids at all, for those that maybe can tolerate retinoids or retinol to some extent, it can be used as sort of a complementary tool. Instead, we always tell patients who are using retinols for either anti-aging, for acne, if you get dry or irritated, just use it with a moisturizer. The problem is, like, a lot of moisturizers just sit on the surface of the skin. They're not well absorbed. They're okay at hydrating at the surface level, but not beneath. So the nice thing about using amnion in conjunction with retinoids as well, maybe to add moisture to the skin, that the retinol might take away is that amnion and through, we were talking about exosomes before briefly, through amniotic exosomes, they kind of signal to the cells to retain moisture. So it's training your skin to retain moisture itself. So not just slapping moisture on the surface, your skin's actually being trained to hydrate itself, which is so cool. So I think, yes, it can be an alternative because of the collagen stipulation to retinoids specifically, but it can also complement their use as well.
So interesting. And I mean, in my experience, I mean, I have not seen many treatments on the market that are using, amnion in as far as with the treatment. And I'm just wondering, were you when somebody when you were approached as far as, hey, got this great product or whatever, and it's got amniotic fluid in it, what was your reaction at first? I'm very curious about that, just because you're such an early adopter of this, and I don't know of many other people that are utilizing it for skin.
Yes, no, you're exactly right. I was kind of taken aback because really there aren't any or many, products out there that contain this. It's kind of, as far as dermatology goes, it's kind of new on the scene. Again, been used for a long time in wound care, but for like dermatology specifically, very new. So I think my primary concern when I was first approached was, well, how do you get this amniotic fluid? I remember that being my first question because, it can be a little bit of a sketchy area. And man, I mean, it's done in such a tactful and consented way, the extraction process, that my mind was put at ease immediately. So, once that was, taken care of, I could kind of focus more on, what this could do for the skin. And I was just so amazed. And so initially, because I had never really had any personal, I had never used amnion personally in dermatology for my skin or for my patients. So I wanted to kind of try it for myself. And, I loved it. Like the feel of it on the skin. It's very, very hydrating. I feel like within only a week, maybe 2 weeks, most things. So when I have a conversation with patients, when they're starting a new product, no matter whether it's for acne, for anti-aging, whatever it may be, I always counsel them on the fact that, listen, like, don't expect results in a few days to a week. Like, let's give it like a month, maybe several months, before we can expect to see results. But I just feel like with amnion, the cell signaling is so strong, and it just, I think it absorbs to the level where it needs to do its work so effectively that you can get results a lot earlier than with other products. So I saw results, just sort of this flow, this hydration. I really do think that I saw a little bit of a reduction in lines, especially kind of these static lines around the eyes, within like a week or two max. So I was sold right away and completely impressed.
Wow. So tell me, on the MD side of things, when you put your MD hat on that, do you see potential as far as using, just amnion in treating things that, obviously, I mean, need indications for, like, for example, eczema, or like, is your brain kind of going in that direction to where it's like, wow, it's working, just topically on the barrier. What could it do for X?
Absolutely. I mean, it's a potent hydrator. So, I think, and we know through the cytokines release, so it releases both um, interleukin 10 and TGF beta. Both of those cytokines help to reduce redness and irritation. So in things like psoriasis, eczema, again, the dryness and irritation that can come from using acne products. I think it could be really, really useful in those cases. And then we can look at it again from sort of a more like wound healing standpoint, and the stimulation of fibroblasts and collagen and whatnot. And we can probably use it post-surgically as well. So in dermatology, especially here in Florida, again, for better or for worse, we're taking off we're excising a lot of skin cancers. So, patients, we always say, put some Vaseline or Aquaphor on the wound for a couple of weeks, keep it moist. Well, what better way to keep the wound moist than amnion, really?
Interesting.
So
Yeah.
a lot of potential applications for sure.
Wow. Wow. And I mean, I know that we're kind of talking about the future. I mean, do you see, I mean, what would be, I guess, your kind of ideal future in kind of going into this world of just birth tissue, really? I mean, again, like I said, I mean, I'm sorry if I sound ignorant. I'm just, it's coming from the, the surgical side, the wound care side, that kind of thing. I can speak for hours and hours and hours, but on, the derm side of things and the SkinCeutical types of things, it's just also new that, it's amazing. And I just would love, kind of your professional expertise kind of opinion on, wow, like where do you see this going?
Oh, I think once the word gets out, I mean, it's going to be huge. I think maybe, initially, just like I had reservations at first, like, well, how do we get this stuff? Like, it's even legal? Just those worries are, quenched. I think people are going to really, buy in, it's very unique. I mean, you think the miracle of birth, and it truly is a miracle. I mean, everything that goes into creating and harvesting, if that's the right word, and keeping this little human safe. I mean, the amount of benefits that surround that are so amazing and unique. And to be able to kind of extract that and those benefits and be able to use it for so many things, especially in the dermatology world, is just amazing. And again, it's human derived, it's natural. I mean, we use so much crap, excuse my language, that's just it's lab derived, it's lab made, and it's just all these chemicals and preservatives and a lot of the even popular skincare products that we use and promote even as dermatologists. But what better than something so natural with so many, again, growth factors, cytokines, all promoting the growth of a human, but like also so beneficial in other ways for our skin. So just amazing. I think the popularity is going to grow as the word gets out and as people feel comfortable with it. And they should. They should. They're using, again, all this synthetic stuff, on their skin. Why not something natural?
Yeah. Yeah. And do you have concerns? I mean, I always think that when it's one thing to treat a wound or ocular, if you've injured your eye, or surgical, that kind of thing. Do you think that you're going to, or have you run into, kind of any ethical, besides obviously the recovery process, but have you run into anybody saying, well, this is for skin. I thought that this was supposed to be for, helping people, or, things like that. I mean, have you received anything like that yet, or do you anticipate? I'm just curious because it just, that's just something that I've thought about, and would love to hear a doctor's kind of opinion on this.
Yeah, and I'm not sure. Can you ask that question in a different way? I'm just not sure exactly what you're asking there.
Sure. Yeah, absolutely. Yeah. So let's say, if people really, if they understand what amnion is, and first, obviously, just like you're going to be asking, okay, well, where do they get this from? Like, what is this, legal? Is this, is it that? Okay, great. You're over that hurdle. then, let's say you get a question in regard to, well, this is for face, this isn't for helping people, like on the wound side, helping do you know what I mean? Like stuff like that. And again, it's a loaded question. And you may not have even received that, and I don't know if you ever will, but it's just interesting to me, like if you've kind of thought about that in regard to that whole, just kind of gray area of, oh, it's for skin.
Yeah, yeah. I mean, I think I haven't got that question yet, but it's interesting to think about in case I do, and how I might best answer that. I mean, I just think that we've learned so much, and we do know, like, I think even longer than it's been used now, on the skin. I know, eye docs were using it for, I think for like things like corneal abrasions and injuries to the eyes and
Yeah,
regeneration that way. It's just
yeah,
amazing. And then again, in wound care for years and years and years. So it is a bit of a new concept to just, slap it on the skin, so to speak. But I think I would say the same thing, to them as I've already stated. The benefits in these other areas have been now shown and proven, over the years. And if it is, effective enough, to heal a wound more quickly than it otherwise would heal, then man, I mean, what kind of benefits are we going to get on the skin? And again, in a sense, in the cosmetic world, we're purposely injuring ourselves
yeah,
to gain benefits. So it's kind of the same idea. We're putting, this agent, this product, on our self-inflicted wounds to promote healing and, again, the collagen growth and stimulation, and regeneration. So I think it can all be tied together, in one, big positive way.
yeah. No, that's great. That's a great answer. I just personally was just thinking to myself, wow, and to your point too earlier when you said, and I really hope this is true, kind of people kind of going more toward natural again and just embracing kind of the whole aging process, instead of going overboard. But if something like this could provide those benefits, as opposed to, just somebody completely and totally changing their entire composition of their face, that if this could give them a boost and, in the natural way, I think we're kind of like we're getting healthier as a country, I guess, or as as in the world. This is actually, this is kind of philosophical, but like in the same way, it's just kind of like, oh, okay, well, we can embrace this and maybe go that route.
Yes, no, for sure, for sure. And I was really lucky, when I had my cosmetic training at Tulane, and even now where I currently practice, our motto and the way I was taught was always like, you don't want to, when you're doing a cosmetic procedure on somebody, and hopefully this is what they want too. You don't want to change the way that they look, right? You almost want them to walk away looking like they've had the best sleep of their life. You still want to look like yourself, or you want them to look like themselves and very natural. Um, you know, so this same concept, I think this is, a road to that same effect, basically, in a very natural way. And it's effective, but subtle differences. I felt like, even like I said, after a couple of weeks of using it, like I looked more well rested, just because my skin looked and felt a lot better. And that's really like all we can ask for. I don't want to look different. And I don't think a lot of people do. We just want to look natural, refreshed, glowing. And again, things may not have always been that way, but I think they're transitioning more in that direction now, which I think is a good thing for sure.
I love hearing that. Yeah, I do. I love hearing that. Yeah. And just super interesting because, I mean, that's kind of the challenge, I'd say, on the just surgical side, wound care side, that whole side of things, because yeah, for years and years and years, it's just been, here's a synthetic and here's, a pill, or here, you got to have surgery. And I mean, I'm not at all, just saying anything bad about the industry, but it is very interesting because what we're seeing on, that side of things is that, yeah, people are starting to, patients especially, and doctors, patients and doctors are really starting to just gravitate over to the more natural, like, ways of, oh, okay, you know what, I can slap this on as opposed to this, and it's not only going to be used as a wound barrier, but it's also going to, supply all of the really good stuff that's in amnion to heal, regenerate, just do all the magic that it does. So that's cool. That's good.
No, you're totally right. And I am in no way opposed to cosmetic procedures and surgery. I mean, I do them for my patients myself and to myself too. I'm not going to lie. My forehead. I love a good Botox
Great.
session for sure.
Yeah. No, I think it's great. Yeah.
That said, we need things too that, in keeping things natural too, just things that can maintain between the things that we like to do in that way, shape, or form. Things that complement. So, you can go in and get a facelift done. Like you can go to that extreme, or Botox or filler or lasers every once in a while. But what are you going to do after number one for healing, and then between those sessions as well, to maintain and to again promote anti-aging, regeneration? Um, we need something. I mean, there's nothing like a solid skincare regimen. I mean, nothing beats that. You can do all of the procedures you want, but if you don't have your like day-to-day regimen down, then it's kind of all for naught. So I think that's where, amnion can fit in as well, is just, a complement and sort of a maintenance in between cosmetics, if that's kind of what you want to do.
Yeah, that's awesome. So what else would you, in the, like, kind of the med spa area, like what else do you see amnion being useful for?
Yeah, I think again we kind of touched on this at the beginning, but on the medical derm side of things as well. I mean, we're seeing patients with severe eczema. We know with eczema, so as an example, eczema is sort of two-pronged. There's the dry skin in eczema, there's the hindered skin barrier, and then there's the inflammation. Well, funny enough, amnion helps to combat both of those things. So we know again through, cytokines like interleukin-10, TGF-beta, we get the anti-inflammatory effects, reduction in redness, reduction in sensitivity, which really, pains people with eczema. And then on the dryness side of things, we have growth factors in an amnion that help promote, again, moisture retention in the skin and help to repair and renew the skin barrier, which is what patients with eczema are really deficient in and lacking. And so I see it being used on the med derm side of things in a lot of ways. Psoriasis, not the same entity as eczema, a little bit different, but same thing. You've got the inflammation, you have the dry feeling skin. So could be used there again for our acne patients. And the nice thing too, getting back to sort of the exosome side of things, that's sort of a big deal right now. in both medical dermatology and cosmetic dermatology and the med spa side of things as well. The problem with, so exosomes are such a big deal right now. And a lot of them out there are adipose derived or liposomal exosomes. And to use that, say, I just mentioned acne. So that's what sparked this idea. To use that on an acne prone patient or an acne prone skin is probably doing that patient a disservice. Yes, it may have some benefits there, but that liposomal content or that adipose content is very oily, very greasy. And
Yeah.
so that's going to promote comedogenesis and acne. So I think it's nice with the amnion-derived exosomes and just amnion in general because it's human-derived and not adipose-derived or produced in a lab where they're using sort of a fatty bilayer as a means of better transport. I think it's non-comedogenic. It doesn't feel, oily or greasy on the skin. It's not going to promote those clogged pores and acne like the adipose-derived exosomes may. So,
Oh, wow. That's interesting. Have you done anything like that with your patients yet, or are you still kind of just waiting it out and like because I know that you're fairly new to, using amnion in the practice.
yep, no, definitely, definitely. I have a couple of patients that I thought of, and again, I think I'd used it more for hydration and moisturization. And there's so many acne patients that are so afraid to put any sort of moisturizer on their skin, whether or not it's non-comedogenic or not, just because they feel like everything breaks them out. So, especially those acne patients that are retinoid sensitive but would still like to try and use a retinoid for their acne. I have, given them the option of trying the amnion, and they've really done well with it. They
Oh,
feel
okay.
more hydrated, and I know we don't have any studies backing it, but I really do feel like because of its anti-inflammatory effects, that it actually could possibly be, I don't want to say it is, but could possibly be helpful for acne itself as well. So,
That's amazing. And, I mean, what we were talking about earlier, as far as just kind of like the ethical considerations of just like rubbing it on, I think that, I mean, acne is horrible. And I wouldn't want anybody to go through that. It's painful. I know it makes people self-conscious. I mean, so that's awesome to hear.
yes, and I think too, where it can be used, we were talking about topical retinoids. Well, we use Accutane as well a lot in our practice to treat more severe nodulocystic acne, which to your point can be very painful. It's a nightmare. So, it's nice to have something like Amnion to be able to offer these patients for hydration because the and anti-inflammation as well, because the Accutane, it's it's a miracle drug and it just changes these patients' lives because it's really the closest thing we have to a cure for acne. But it is dreadfully drying and irritating. So, it's nice to be able to have this to combat some of that irritation and dryness that the Accutane can promote, because otherwise it can be tough to get through sometimes.
Wow. Okay. Well, I mean, this has been super interesting, I mean, I have learned so much and I really, really appreciate your time and obviously being on the board. I mean, I feel like this I feel like this discipline more than any other discipline has. I mean, all of it obviously has so like much potential, but this has been kind of untapped and it's just fascinating that you're using it in all of these variety of ways and treatments and I just really look forward to seeing you, really go, oh wow, okay, well, it works here. So how about here? How about here? And really, really hope that we can do some studies and that we can, just work together and really figure out, wow, what else can this do?
Oh no, I'm so excited too. I mean, I'm sure areas where it could be so helpful that I'm not even thinking of. And the longer it's in play, I think we're going to find it does amazing things for so many conditions in dermatology specifically. So I'm super excited. I'm grateful to be a part of something so new and something so incredibly helpful and beneficial. And I think it's going to do wonders for so many conditions and people in the future.
That's awesome. Well, thank you so much. Thank you so much for joining us. And I know we'll be talking again soon. I know you'll be on again, but
I'd
just
love
really,
to.
really appreciate it. Yeah. So, Dr. Ellis, you're wonderful.
Thanks, Theresa.
Thank you. Appreciate it. Bye.